Lady yields back. Chair, recognize the gentleman from Ohio, Mr. Latta. 5 minutes for questions, please.
Well, thank you much, Mr. Chairman, and thank you very much to our panel today. We greatly appreciate you being here, and this is a very, very important hearing that we're having today. Ohio, in 2015, we lost 3,050 people because of opioid overdoses, and last year, that total went up to 4,050. And our county coroners are now predicting that, unfortunately, we're on a pace to exceed the 2016 numbers. And I held my a second opioid forum, and that was held last week. And, you know, when you're talking about these statistics of 3,050 or 4,050 people losing their lives, you know, those are the statistics, but you put a face with them. And I talked with a parent who had lost a child because of opioid overdose. And it's, you know, it's heartbreaking. And so I'm very happy that you're here today because this is a very important subject and that we are in an epidemic across this country. And Dr. McCants, Cates, if I could start with you, CARE provided significant funding for states to expand substance use disorder treatment through grants administered by SAMHSA. In addition, CARE required that grantees submit data that will be posted online and easily searchable. Can you provide us with a status update of those requirements?
Yes, so SAMHSA has awarded grants under the CARA initiative, the legislative requirements. Some of those, we call this our MAT-PDOA program, which is focused on medication-assisted treatment specifically for prescription opioids and heroin users. And so we are collecting data, and that data will be available at the end of the program, and it will be available to individuals to easily analyze. Yes.
Let me follow up too. And what accountability measures is SAMHSA requiring of states to make sure that that grant money is being wisely spent out there?
Yes, thank you for that question. What is required is that they submit to SAMHSA their plans for their states and what practices they intend to use. We review those, we provide guidance to them, and in the terms and conditions of grant award, they are required to use evidence-based practices going forward, and so we will be working very closely with them. Now, that requires that we provide them technical assistance so that they can make determinations of what evidence-based practices are best for their communities, every state being different, of course. And we are developing a new program of enhanced technical assistance where we will help states to get experts from the various fields that provide care in substance use disorder treatment, psychiatrists, addiction medicine specialists, advanced practice nurse practitioners, physician assistants, social workers, peers, that will be available to states to help them as they think through their needs and put evidence-based practices in place.
Well, thank you. And when we had the forum last week in my district, one of the things that came up, and this pretty much be a yes or no answer for all of the panelists here today, it's part of the issue is for a lot of the folks out there is a lack of reliable information and data that's available out there. And it's difficult for many of, especially smaller communities, to find funding streams and access information on how effective government programs have been to combat opioid abuse. I'm working on a bill right now that would create a publicly accessible electronic database to help mitigate these problems. And I'd just like to ask each of you real quickly, if yes or no, would you all, as we're working on this legislation, to collaborate with me to make sure we can get this information out there to the public? Because again, it's a very, very difficult thing for the smaller communities, smaller agencies to do. So if I just go right down the line, if I could ask for your cooperation on that.
Yes, sir, Congressman.
Yes, happy to do that.
Yes, sir. We'd be happy to work on that.
Yes, absolutely.
Well, thank you very much. And maybe if I just follow up with the remaining time that I have with FDA, you know, we were talking, you were mentioning, Doctor, about that, you know, what we have with the epidemic we have in the United States, but looking around the world, do other countries have the same situation that we have with this opioid epidemic?
I would defer to my colleague from SAMHSA, but my experience with the data is no, Congressman, and prescribing in other countries isn't as rampant as it is here in the United States.
So you're saying it's on the prescribing side because of where we've gone? Maybe I could just, Mr. Chairman, I'm a little bit over my time, but if I
Certainly
could ask.
started on the prescribing side. We still have, I think it's a fair assessment, we still have too many prescriptions being written, particularly for the IR formulations of these drugs. 190 million prescriptions a year, it represents 90% of all the prescriptions that are written for opioids. But increasingly, it's shifting to a problem of illicit drugs and low-cost alternatives, which are the heroins and the synthetic fentanyls.
Well, thank you very much, Mr. Chairman. My time has expired.